My name is Angelica Peterson, and today we're going to talk about laminitis. Okay, so laminitis is also known as founder. It's painful um, for a horse and it affects their hoofs, and it also leads to severe lameness. So, laminitis refers to the inflammation of the laminae, the tissue layers that connect the hoof wall to the coffin bone inside the hoof. So at the tip of the hoof lies the coffin bone, a structure. Um, triangular structure securely attached to the hoof wall by sensitive and insensitive laminae. These layers are supported by a network of blood vessels, ensuring constant regeneration and health. Okay, so laminitis occurs when bacterial endotoxins and lactic acid disrupt the blood flow to the laminae. It causes it to swell, and it's very painful. And it can also cause tissue death in severe cases. There are two main forms of laminitis. There's acute, which is the sudden onset, and then there's chronic, which refers to damage over a long term, and usually happens with reoccurring episodes. Okay, so finding out if the laminitis is chronic or acute is very detrimental, because then we know how to progress with treatment and management. Okay, so the causes and risk factors for laminitis, um, usually it involves a sudden increase in carbohydrates in your horse's diet. It can also result from uh, like excessive exercise or a concussion, which is a injury to the hoof. These can be seen usually during endurance competitions. Um, or there could be a lack of exercise, um, or improper shoeing by your farrier, or there can be excessive weight bearing on other limbs that are not affected by laminitis, which could also cause laminitis in those other hoofs. Um, so the horse's hoof, if it's the cranial limb, which is closer to your horse's head, if those are affected, they're gonna rock back on their caudal limbs, which is towards their back end, so their hind legs, to relieve the pressure. So, like, additional improper movement patterns um, are going to be another factor. So if they can't adduct or abduct the hoof properly, um, due to the laminitis, it can also exacerbate the condition. So diagnosing laminitis is done through X-ray. And here you can see an X-ray comparison. Left is a healthy hoof, and on your right is a P3 or coffin bone rotation, which has resulted in laminitis. And then let's move on. Okay, so here is just a picture, kind of describing a little more from the X-ray. So the P3, as I said, is your horse's coffin bone, and as you can see on your left, it's a healthy one. It's balanced. It's the pressure is great. It's not ruptured or anything. And on your right is a chronic lammatic foot. Um, and see here you can see the coffin bone rotation in a downward stance, which means that your hoof is unbalanced and has become laminitic. Okay, so signs of pain in horses. This could look like teeth grinding, facial grimaces, difficulty with heels, unusual sweating, unusual stance, and staring at their bellies. Here I've included a equine laminitis infographic. So a common year-round welfare concern causing pain and lameness in affected feet, finding from the CARE study. On here you can just kind of look and see um, that 1 in 10 horses or ponies develop an episode of laminitis every year. So, and that's uh that's a lot. And you can like see on here 78% have difficulty turning, 72% had a short stifled walk, 70% were lame at walk, 51% had bounding digital pulses, 58% had increased hoof temperatures, 51% shifted weight from foot to foot, and 51% were reluctant to walk. And surprisingly, only 50% of these laminitic episodes were diagnosed by a vet. It's really important to make sure that you take care of the hoofs properly with cleaning and proper shoeing and proper diet to prevent laminitis. Thank you.